This e-learning discusses an issue that many people with autism face, but which is barely discussed in scientific literature. Last year, Annelies Speck wrote a groundbreaking article on the subject, and this forms the basis for this training. Autistic burnout is seen as a burnout of life that is mainly caused by masking autism, and not by autism itself. We differentiate it from traditional burnout and depression. We list a number of interventions that can provide a first approach to autistic burnout. Finally, the e-learning illustrates the importance of a safe environment at work, where autism is accepted. Autistic burnout has three main characteristics. First, a pervasive long-term exhaustion. Second, a decline in skills such as executive function. Third, lower tolerance to sensory stimuli. The 2021 definition by Huygens and co. reads as follows. Autistic burnout is accompanied by many limitations and is preceded by enormous fatigue. It is caused by camouflage or masking of autistic features, interpersonal interactions, large cognitive input, and sensory overload. The following criteria were identified: significant mental and physical exhaustion, social withdrawal, significant reduction of skills in various aspects of life, confusion, problems with executive functions and/or dissociative function, reinforcing autistic traits and reducing the ability to mask. What is the difference between a classic burnout and an autistic burnout? Autistic burnout can be seen as life stress, as opposed to classical burnout. It is more commonly defined as work stress. We see autistic burnout as the result of a combination of stress in different areas of life. There is no cynicism or sense of distance from work to be noticed. On the contrary, people with autism want to work and even enjoy it, provided that their needs are taken into account at work. However, they have too little energy to work effectively. If there is any cynicism at all, it is not directed at the work, but rather at the interaction with neurotypicals. On average, autistic burnout lasts longer than classic burnout. There is still uncertainty about the job level after recovery. What is the difference with depression? People with autistic burnout can still enjoy things, but just lack energy. People with depression experience less pleasure in activities. Autistic burnout involves slightly fewer sleeping problems than depression, and autistic burnout is built up by excessive pressure from stimuli. This is less the case with depression. What are the main causes of autistic burnout? Annelies Speck distinguishes four important causes. Masking the autism is the main cause. The second cause is the expectations of the environment. The third factor is dealing with limitations. Finally, dealing with changes. The most important is the masking of autism, and not the autism itself. 70% of people with autism say they regularly camouflage their limitations. The reason is a difference between the natural state and the expectations of the environment. In the short term, camouflaging seems to have advantages. Because people with autism seem to be better integrated and participate in education and work, they therefore feel that they effectively gain more from this strategy. The risk, however, is that in the long run, this masking can cost too much energy. This causes them to go beyond their own limits and greatly increases the risk of burnout. We must pay particular attention to people with strong verbal skills, because there is a greater risk of underestimating autism there. The second cause is the expectations of the environment. We see that there is a great deal of uncertainty surrounding what exactly other people expect. What must I do to do well as a partner? As an employee? As a student? There is a high probability that the environment overestimates the person and underestimates the autism. It is also difficult for them to take information from the context as feedback. The third cause is the limitations of autism. Some issues that people with autism may suffer from are difficulty with change and increased sensory sensitivities. It is difficult for both the person himself and his environment to see these limitations. On the one hand, this is because the person himself has difficulties recognizing his own emotions, and on the other hand, because of the camouflaging, the environment does not see the problem. People with autism often fail to recognize when they are tired or overworked, and so they overstep their limits. Stress through life change. Transition phases in the life course, such as the transition from study to work, independent living, or starting a family, bring with them new uncertainties and unknowns. This increases stress. For this reason, it is stated that help with autism is necessary throughout life. What factors can complicate the healing process? 4 aspects play a role in this process. The feeling of not being heard. Difficulty respecting one's own limits. The need for time-outs. And last but not least, finding appropriate help. According to Raymakers, people with autism often report the feeling of not being heard. This is partly explained by the fact that asking for help is a complex task for people with autism. They have to know what they want to ask, to whom, when and how. This requires them to use communication skills that are often the very challenge. In addition, it is often difficult for people with autism to recognize and express their own emotions. This is called alexithymia. Answering the question, "How are you?" is therefore not always obvious for someone with autism. Finally, we see a factor in nonverbal communication. There is often no correspondence between the facial expression of someone with autism and the underlying message. As a result, the environment tends to give less credence to the message. It is often said that if you want to know how someone with autism feels, you have to ask, but make no attempt to deduce it from the facial expression. It is only possible to guard boundaries when one recognizes body signals well and feels the boundaries oneself. This is precisely an aspect that is more difficult for someone with autism. Moreover, it is not easy to automatically make the link with the context, making it sometimes unclear where the boundaries should be drawn. If a person senses the boundaries, it is also important to be able to communicate them in a fluent way. Sometimes people with autism communicate this too directly, which makes it harder for them to count on the environment's understanding. Taking structural timeouts can help enormously, because there is a fixed structure. If we ask the person to take a timeout when they need one, the difficulty in recognizing emotions may mean that their need for a timeout is overlooked. Filling in free time is difficult, so it is recommended that an activity plan also be drawn up to fill in the timeout. Appropriate help for autistic burnout is essential. Sensory overload must be taken into account. In a work environment, an integrated approach of employer, health situation, and autism coaching is recommended. What can we do? Unfortunately, much scientific research still needs to be done on the treatment of autistic burnout. Based on clinical practice, we can already recommend the following. Examine the straining factors. More rest can help. Draw up a signaling plan. Maintain a daily structure, as much as possible. Social contact can be a strain. Try to encourage contacts where there is no need for masking. Learn to recognize and communicate boundaries. Attention can go to acceptance of limitations. In conclusion, work can be part of the therapy, provided that we take their needs into account. Knowing that camouflage is the main cause, it is important to create a safe working environment where people feel comfortable.